Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about study tips for medical coding exam test takers. Now, if you are brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I really love what I do, so I like sharing all the things that I know. And if you haven't had a chance to, I hope that you'll hit that subscribe button. I hope that you'll hit the like button if this video helps you. And if it helps you at the end, I hope you will share it. Okay? Let's get started. All right, so you are about to take your medical coding exam. Oh, the big thing, the huge credential, and it's time. And you are nervous. And what do you do? How do you prepare? And you're getting ready. What's the deal? Okay, so we've all been through this. Okay, we've all had that anxiety. We've all had that excitement and nervousness about taking our test. Here's the thing. The thing about getting prepared for whatever credential exam that you are going for, whether you are going for an AHIMA credential, the American Health Information Management Association, or with AAPC, the American Academy of Professional Coders, each one has their own separate individual coding exam prep books. You can get those, and I always recommend getting those because it will at least set you up in that sort of mentality of this is a test, okay, and this is how you're breaking it down, okay. Not to say that these are necessarily what is on the test, okay, but it is formatted like the test. So keep that in mind. You want to make sure that anything that you struggled with while you were in the program, if you've been taking a program or if you've been doing independent study, any of the things that are tripping you up is what you need to really concentrate on. And there's really no way of telling you like, oh, well, you need to concentrate on this or you need to concentrate on that. The only thing that I can recommend for you guys is that if you've struggled with a particular subject like evaluation and management or with procedure coding, then that's where you need to concentrate on because that's probably where you're going to struggle with the most. Now, if you are getting ready and it is like a month before you take your exam, you need to set yourself up on a schedule. That is the best thing that you can do for yourself. Whenever you have structure, right, it helps to bring down some of that anxious feeling, okay? Don't have the first thing in your head be, what if I fail? Please don't do that to yourself because it's setting yourself up for failure when you do that, all right? You are capable and you have the ability to do anything that you want to do. You made it through the program. You are preparing now for your test. That should tell you something huge right there because it's nothing to sneeze at to get through all those modules in your course. So think about that. You made it through all that. You can make it through your exam. And you have to have a positive attitude. Okay, that is really, really important because what you think and what is manifested around you is what you are putting out. All that energy that you are putting out is what you are going to be able to get back. If you overthink, that is a dream killer, okay? That will take and suck out all your energy and everything. Don't do it. Don't overthink. Go with whatever you are going to go with first, all right? Which is why I tell you guys, if you're struggling with a certain subject, then you need to concentrate on that. Get the exam prep books so that way that you can have a format that you can go with as far as like practice. And like I said, if it is a month, do a schedule and like once a week, try to do a mock sit-down exam. However long the exam is, for whatever credential that you're taking, these exams range anywhere from 2 hours to 4 hours, or 5.5 hours, or 5 hours and 40 minutes if you're taking a APC credential exam. Now, check the times, all right? Check the times because each credential has a different time limit. So make sure that you check the times and the time. Whatever credential exam you're going for, whatever the amount of time it is, set aside that time and do a mock exam where you are literally with no phone and you are setting it up like it is an actual sit-down exam. Sometimes this is too much for some people and they'll say, well, Blue, I don't have 3.5 hours to squirrel away and do this by myself. I'm just telling you guys what my recommendations are. All right. You want to get yourself prepared and ready. And yes, there are people who have family obligations and they don't have the time. If you don't have the time, break down the number of questions by however much time that you have, and then work on that amount of questions for that amount of time. Break down the questions by minutes. So if it, however many questions are on this exam that you're taking, divided by however many minutes, and don't do the hours. Do, of course, like if it's 4 hours, then you would divide it by 240 minutes. Okay, 60 minutes an hour, that kind of thing. And that way you can find out how many minutes you have per question. Well, then that's when you would break it down that way. But I always recommend setting yourself up for the exact amount of time, because that's exactly the amount of time that you're going to be in that exam room. And be away from your phone. Be away from anybody that's going to be distracting you, and work on doing that. Guys, this is just temporary. It is not forever. This is just temporary. So if you have to get the other people around you to support you and rally behind you in this, that's what you need. All right? Because what you do is going to benefit everybody else around you. If you are getting into medical coding as a career and making it better for your family, this is what you need from them. Okay? And this is when you're going to have to put your foot down and say, look, guys, I need this time to study. And you really do have to set that up, because the thing is, yes, sometimes kids don't understand, but we need to have this explained, and so that's the thing. And again, these are just my recommendations. If you want to set yourself up for success, there are some things that you have to do, and you have to take the bull by the horns when it comes to these types of things. Trust me. If you invest in time to study and do this practice before you take your exam, it's going to benefit you when you go to take that exam. These exams are difficult. They are not meant to be easy. They are not meant to be a cakewalk, because if it was a cakewalk, then everybody would do it. And then the value of a medical coder would go down. So we are very valuable. We are highly valued when our function is known and appreciated. We are highly valued. Okay, so doing that and getting yourself ready is what you need to do. Again, it's just temporary. It's until you pass your credential exam, and then you have the next challenge of finding your first job. Now, the other thing that I can recommend for study exam prep, okay, is to make sure that you are working on your speed. Now, what I mean by working on your speed is when you're looking up codes in the book, because remember, we can't use an encoder or a computerized software to look up codes. We have to look them up in the book. So it does take time. So make sure that you know how to look stuff up in the book. Do not, whatever you do, and I know we always talk about this all the time. They talk about it in school. They talk about it in the books. Do not just use the index to get the code. Okay, you need to verify it in the tabular section to make sure that there are no other notes that you need to look at. There's nothing else that you need to be aware of when you're applying the code for whatever the situation is. Okay, so you need to make sure that you are looking up in the index and you are looking up in the tabular section to make sure. Okay, if you, again, make sure that you are knowing how to do that. Work on your speed, work on your speed, work on your speed. That is where a lot of people get hung up. I will get emails from people who said that that's where they got hung up on looking up stuff, and they took their time, they took too long. Guys, you got to get to the point and you got to move on. Also, don't overthink. Like I just mentioned, overthinking is a killer of dreams. What happens when you overthink? Those precious minutes start to tick by. And all of a sudden, by the time you know it, you're out of time. Don't overthink. Go with whatever your first instinct is for that question and move on. Don't overthink, because by the time you know it, you won't have enough time to look at all these other questions, and you won't have enough time to think about all these other scenarios, all right? You're going to have to just trust your instinct, trust your knowledge, trust your teaching, trust your first instinct, and go with it. Because the second you sit there and you start overthinking and you get on that hamster wheel, everybody's gone on the hamster wheel. Trust me, I go on the hamster wheel. it just takes too much time. So make sure that you are doing what you can to get through as expediently as possible when you are getting through your exam, because like I said, these exams are timed. You only have so much time, and that's all you can do. And then the other thing that I would have to touch on would be, well, Blue, what happens if I fail? Okay, well, what does happen if you fail? You fail. Now what? You do it again, and you keep going until you get it. Now they say, well, Blue, it's a lot of money. Well, it's an investment in your future. Everybody's path to medical coding is different. Everybody's journey in medical coding is different. So if yours involves spending a little bit more money to get there, then that's just part of your journey. This is an investment in your future. If you are sitting there and you really truly believe in yourself and your abilities, you can get this. What messes people up is when you start sitting there and overthinking. That's what messes people up. When you have the confidence in yourself that, yes, you can do this. Yes, you are going to do this, and you are going to get that next credential, and you are going to be able to get a good job, and you're going to have this wonderful profession that you're a part of. That's what you need to be focused on. Because anything else, all this other little negativity, garbage talk, oh, I can't do it, or what if I no. The second you start feeling that, no, start suppressing that, because that's garbage talk. That all that is just garbage talk. You got to be able to be the one to lift yourself up. The only ones that can do anything for yourself is you. No one else can. You can't blame anybody else for the fact that you didn't pass your credential exam. You were the one sitting there taking that credential exam. You are the responsible one to pass that exam. And when you do pass it, that victory is completely yours. Yes, you can. Obviously, if there's people that supported you during that time, of course, thank them. But at the end of the day, you're the one in the driver's seat taking the test and going through those motions. So you have yourself to thank. Now, again, if you fail it, take it again. There's nothing wrong. There's nothing wrong with taking it again. I've known many people who have taken their certification exams many times before they had to pass it. You know, and it's just something psychologically that happens with us when we are taking exams. Sometimes some of the most smartest people will take exams and they'll fail because they get nervous, or they get like where they start overthinking, and there's all of a sudden it's all this pressure. All of this stuff we do to ourselves, okay? So this is why I say that go in there with the strength and confidence that you have, and that you know what you're doing, and get through it. That way, when you do get it, then you got it, okay? But it is a lot, but it's worth it. To me, it's worth it. And a lot of people ask me, is it worth it? I don't know if I'm going to be able to find a job. Don't put all that negative crap in your head. You can. I would, for once, love, and I do get them occasionally, but to say, I'm going to take my exam and I'm ready to pass. I can't wait to get out there. That's somebody with a positive attitude. And yes, we need to be realistic, but when you are putting in the time, you're putting in the blood, sweat, and tears, you will get it. You will. It's all on you. It is entirely, completely on you. All right? And again, if you know, you're telling me that I don't have the money for it, I can't, you know, this is the requirements. This is what is part of this, getting into this. All right? And even when you do get your credential, you're still going to have to pay to maintain it. All right? Whether you are going through having your continuing education units, whether you have to pay for them, or whether you have a facility or doctor's office that pays for your credentials, your continuing education units, you still have to pay some way to maintain them. All right? This isn't just you test once and then you're done. No, you have to pay to continually educate yourself and submit those units so that way you can maintain your credential. Every association credential has a different amount of CEUs that you need to report. So I don't know. If you ask me how many it is, I don't know. I honestly could not be able to answer that question for you, but you will be able to know by going to your association website and looking up how many continuing education units are required for that credential. All right. And I will leave both links for both the American Health Information Management Association and the American Academy of Professional Coders down in the description box below, so that way you guys can reference that information. Get familiar with the websites. I get a lot of questions that are basic questions that can be answered by going to the website. I know a lot of times it's easier just to go to somebody that knows or that you think knows. I get a lot of questions from AAPC members. Folks, I'm not an AAPC member. I am with the American Health Information Management Association. So if you are with AAPC, I can tell you some things. I can't tell you everything. I don't know everything about AAPC. And neither one of these associations, neither HIMA nor AAPC, pays me. These are, I'm not paid by them to advertise for their associations. I just do it because I'm a medical coder, and I give you guys all the information for both associations. So whether you are with a HIMA or AAPC, you can get information. You know, I'll be able to tell you the things that I do know about AAPC. But again, anything specific, you can go to the websites. You can contact the customer service hotlines because they are there to help people. I will say with AAPC, they are very, they are right on it. They they have sales all the time. They have, when you go to their website, when you go to the AAPC.com website, their little messenger thing pops up. How can I help you? How can I help you? And I'm like, really? You know, because I've had to do research more than a couple of times. Like I said, I like to bring you guys information and let you guys decide what association you want to go with. So again, all these questions about like what books are required, how long are the exams, these can be asked by simply going directly to the websites themselves, and they do have all that information there. So make sure that you go to the websites and get all that information that you need. But yes, rest before. When I took my credential exam, I rested before my mom told me to stop. And so I stopped. I have said it many times in my videos. I owe my career to my mom because she was there and she supported me for everything, the whole step of the way. She was there, and I'm very grateful and thankful for that. But she told me, you're not going to learn anything new in the last week before you take this exam, so just stop. So I stopped, and I just took a break. And by the time I knew it, when it was time to go take the test, I was ready. And so that's how I did, because I don't believe in cramming. Anytime you cram before a test, it does not do you any good. All it does is just mess with your head. And you have to be relaxed when you go in for these exams, because if you're nervous and you all of a sudden you can't think, you've just defeated the purpose of going to go take this exam. So that's my recommendation. Use your flashcards when you're studying. Get your family members or anybody that you're in a study group with, get them to sit there with you and do these drills, and, you know, stay out of the Facebook medical coding groups. I will say this and say this and say this. Even if you are looking for support when it comes to taking your coding exam tests, don't do it. Stay out of there. You need to concentrate on yourself and don't listen to anybody else, all right? Because having somebody else in your head, any other kind of negative talk in your head, that is going to mess with you. So don't do it. I'm telling you guys now. I'm giving you guys encouragement to do it. And yes, there are probably other ones that would, be out there encouraging people. But again, if you're trying to look for encouragement from a medical coding Facebook group, don't do it. Just stick with yourself and just concentrate on your studies, and don't worry about what anybody else is saying. Okay, because then you're going to have somebody else's experiences in your head, and you don't need that. All right. I am very, when it comes to Facebook, I'm like this. I'm like the Heisman Trophy, I don't, Facebook is good and it is bad in a way. Facebook is for like For me, Facebook in my mind, which is why I don't have a Facebook page for Medical Coding with Bleu. I don't have one for my channel because of the simple fact that I feel like Facebook needs to be just for people's personal friends and family. I do occasionally get friend requests on Facebook. I've stopped it now where there are none. You can't friend me. If you do try to friend me, it won't go through because I don't have it where like outside people can friend me. I only have friends of friends because I feel like that's my private life for Facebook, and I would not want to be on Facebook sharing all this information or whatever. And I do have it on lockdown. I do have my own personal Facebook on lockdown. But that is, to me, that is what Facebook is for. Facebook is for your friends and family. And I keep my circle of friends and family very close to me. So family is who I consider family. My friends who I have been very close with over the years, who I have considered my family, are part of my Facebook. So again, this is why I don't, when it comes to Facebook, nope. I don't have an Instagram for my own personal use. I have an Instagram for the channel. And yes, I do post my outfit of the day. I haven't done it in the last week. Last week has been incredibly hectic. So, but I do post other things like the books that I recommend and things like that. If you're asking me what books, what flashcards do I recommend, I have it all on my Instagram page. So make sure that you check out Instagram if you are looking for recommended study books or anything like that. I do post them on there, so that way you guys can see those things. But yes, Facebook to me is for friends and family, and that's for catching up and doing all that stuff. It's not for business stuff. So that's why I'm personally not even involved with any of the Facebook medical coding groups at all. And I have been invited to go on there to introduce my channel. I feel like if people are going to find my channel, they're going to find my channel. I don't need to be putting it in Facebook so that people can find my channel. Okay. I'm on Instagram, I'm on Twitter, I'm on Patreon. So that's plenty of other avenues for contact. So just something to keep in mind. Stay off Facebook for medical coding, I think. Use that as your own personal thing if you are on Facebook and that's what you do. Some people are on Instagram or Snapchat. I mean, that's how you communicate with others, and that's what you do. But yeah, like I said, Facebook is a personal thing, and it's not for looking for encouragement, I think, for medical coding, because a lot of times you'll find the opposite. So I'm just saying. But yes, those are my tips. Just take it easy on yourself, and don't beat yourself up if something happens and you feel like you didn't do as good as you should have, but you still passed. Don't beat yourself up. You got your credential, okay? That's all you need to be worried about, and just get ready for a wonderful career that you will have to fight for, but you will be able to get into it once you really start investing the time into it and getting into it. And then once you are into it, then you can start exploring more. But never, ever give up studying, okay? That is something that even after you get done with your program, and even after you get your credential, you're still going to have to study. Because now, when you get out into the real world and you're looking for jobs, it's going to be the caliber of the coder that's going to make the difference. So, still continuing to study and having your credential in your hand, and then being able to answer any questions that a potential employer might have, is a really good thing. Well, Blue, what kind of questions? It's all going to depend on wherever you go. I've had many, many different types of questions, so there's really no way to prepare, especially for these job assessment exams when you do go and start applying. So you just have to be prepared and ready for anything. But knowing your basics, knowing how to look up codes, knowing how to find information, that is going to be the key. All right. So that's going to wrap it up for me today. I will be back tomorrow for tomorrow's episode, but I hope this helps in some way. Other than that, I mean, it's very basic. There's not like a whole big, huge secret. It is just get through it, trust your instinct, get rest. Don't be nervous. It's going to be a good thing, especially when you do pass. Okay. And if you have to take it again, you have to take it again. There's no harm in it. So I will go ahead and wrap this one up. But thank you guys for joining me. I will see y'all on the next episode. So if you're a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.